يلا start دكتور محمد.
Okay, hello.
Hello.
I'm Dr. Mohammed. I'm senior house officer in the clinic. Am I talk to Mr. Sami?
Yes, I am.
Yes, Sami, you are 19 years old.
Yes.
Okay, please, can you tell me why you are here today?
I'm here today because of the rash. For the last 6 months, I have this rash, on and off. It's not resolving, doctor. Seeking many medical advice with no benefit.
Okay, I'm sorry, Mr. Sami, for your suffering. Please, can you tell me more?
Yes, this rash present in my tummy, sometimes in my elbow. Actually, I don't know why this rash. It's come and sometimes disappear from its own without doing anything.
Okay, can you show me, please, this rash?
Yes, okay.
Okay, is this rash start suddenly or gradually?
I noticed it suddenly.
Suddenly. Okay. Is it there is anything make it is better?
Actually, I noticed when I am wearing tight clothes, it increases the rash. I don't know what is the relation.
Okay, anything make it is better?
I didn't notice anything like this.
Okay. Is there any itching?
No,
Any bleeding or oozing?
no oozing, no bleeding.
Okay. Is this rash? Is this in your tummy? Huh? In your tummy?
Yes, this is in my tummy and chest.
Okay. Is there any other place? This rash?
Same rash present sometimes in my thigh and in my elbow. Same rash.
Okay. Is this rash is constant, same, or increasing or decrease?
It will be like this. Then after 1 week or 10 days, it disappears. And then back again and like this. It's cycles.
Okay. Okay, Mr. Sami. There is any high temperature, any fever?
Yes, I have high temperature. Yes.
Okay. Uh, is this temperature is continuous or any specific time of the day?
I feel this temperature increase at the late afternoon and the early evening.
Okay. Okay, Mr. Sami. Any change in your weight?
I think I lost about 4 kg in the last 2 months.
Okay. Have you any joint pain?
Yes, I have joint pain also.
Okay. Can you tell me any joint?
All my joints are aching, doctor, but more
I'm
in my
sorry.
knee, my elbow, and my wrist.
Okay. There is any association with this pain and swelling?
I didn't get the question, doctor.
Any swelling in your joint?
Yes, sometimes I feel swelling. Yes.
Okay. And okay, Mr. Sami. Uh, yes. Have you any headache?
No,
Any blurred or your vision?
no.
Okay. Any bump or lumps in your body?
I feel some lump and bump in my neck.
Your neck. Okay. In bilateral or one side?
I feel it more in the left neck.
Okay. And okay. Have you any cough?
No cough.
No cough. Any shortness of breathing?
No.
Okay. Any chest pain?
No chest pain.
Any heart racing?
Sometimes I feel awareness of my heartbeat, especially with effort.
Okay. Any tummy pain?
Yes, I have tummy pain.
Okay. Where is this exactly in your tummy?
It's mostly on the left upper tummy, left upper side of my tummy.
Okay. Is this pain is can you describe this or this pain like
The pain is
this
like dull aching, pain, like dragging pain, something heavy, like this.
okay. Is this pain go to anywhere from this left upper quadrant?
No, I feel it more on the left upper side of my tummy.
Okay. Please, can you grade your pain from 1 to 10? 1 is minimum, 10 is maximum.
Regarding this pain, no, it's you may say 3 to 4.
Okay. Okay, Mr. Sami. Any hard stool?
No,
Any feeling sick?
no,
Any difficulty of swallowing?
no,
Okay. Any bleeding, I'm sorry, by back passage?
no.
Mm, okay. Mm, uh, have you any past history that I must aware of?
No, doctor. No past medical history of not.
Okay. Is there any family history, same your symptoms?
My sister has a condition called systemic lupus erythematosus. Has a condition called familial Mediterranean fever. And my
O-
father has sarcoidosis.
Okay, I'm sorry. What happened to your sister and father? Okay, and okay. Have you any medication in regular base? Hello.
الو
Yes. Have you any medication in regular base?
لحظه يا دكتور محمد.
Okay.
What's going on? الو
Yes, I'm with you.
سامعني كده؟
أيوة أنا سامعك أنا.
معلش شكل السماعه فصلت بس.
Okay.
اتكلم كده عذرا بس الانتربشن.
Okay, no problem.
اوكي معلش سوري حد رن بس فصل. سوري دكتور. اوكي.
Okay.
My sister has a systemic lupus erythematosus. My father has a sarcoidosis. My brother has FMF.
Okay. I'm sorry what happened to your family. Okay. Have you any medication in regular basis?
No, I am taking only paracetamol because of this high temperature and joint pain.
Okay. Have you any allergy to any medication?
No.
Okay. Have you history of any travel?
I traveled to India before 6 months.
Okay. Then what is the reason for travel or how your stay there?
No, it was only I stayed in 5-star hotel, eating from inside. It's only just visit tour only.
Okay. Any mosquito? Any?
No mosquito bite, nothing.
Okay. Okay. Mr. Sami, are you? I'm sorry asking this. Sexual active?
Yes.
Okay. Are you have a partner?
Yes, I have regular partner.
Okay. You have any casual sexual extramarital or extra partner?
No, no.
Okay. Okay. Okay, Mr. Sami. Okay. Okay, Mr. Sami, can I examine you?
Sure, doctor.
Okay, I will start with around the patient, surround the patient, and I will start from
Yeah.
hand.
Okay.
Okay, and I will.
What you search for in the hand?
Yes, I will search in the hand if there is any this stigmata of infective endocarditis.
Okay, there is no stigmata of infective endocarditis, but you have to ask about all stigmata, all causes of infective endocarditis in his. But there is no
Yes.
stigmata of infective endocarditis.
Okay. Okay. And I want to check the pulse.
Okay, the pulse 110, equal, regular on both sides, tachycardic the patient.
Okay. I want to see the eye, any pallor.
There is pallor, no jaundice.
Pallor, no jaundice. Okay, I want to check in the mouth, any sore.
No sore in the mouth.
Okay, the lymph nodes in the
You
neck.
could appreciate, yes, you could appreciate anterior cervical lymphadenopathy, which is firm and tender and matted together, not attached to the underlying.
Tender, huh?
Not tender, not tender.
Not tender. Okay. Okay. On the so I want to check. Yes, I want to check this for in the chest. I want to check in the chest any crepitation.
There is no crepitation in the chest.
Okay. In the heart, I want to check epics and heart sounds. Any murmur?
No murmur, but there is tachycardia only.
Tachycardia. Okay. In the tummy, in the abdomen, I want to check superficially. Okay.
What
If
you are
you
searching for?
have any discomfort or pain, please let me know. Okay.
Okay, doctor. What you are looking for in the tummy?
In the tummy, I want to see that for the any organomegaly.
Okay, you could appreciate a 2 centimeter enlargement in the spleen below the left costal margin, about 2 centimeters. No hepatomegaly.
Okay. Is it tender?
No.
Not tender. Okay. Also, I want to. Okay. I want to check lymph nodes or the inguinal lymph nodes.
Wait, doctor, there's some. Please, doctor, unmute yourself. Okay, Dr. Muhammad, I will mute all and you will unmute
Okay.
yourself.
Okay. Okay. I will open.
You unmute yourself. Okay.
Okay. I will check inguinal lymph nodes.
Okay. No,
No
nothing
inguinal.
there.
Okay. I want to check for liver, any splenomegaly.
Liver splenomegaly can't come. Liver, no hepatomegaly.
Any liver
Splenomegaly
hepatomegaly.
is no. Splenomegaly already confirmed 2 cm below the left
2
costal.
centimeter. Okay.
Yes.
Okay. I want to check.
2 minutes
This
remaining.
skin rash. I want to skin rash is blinchable.
It's not blanchable. It's raised. It's not itchy or oozing. And the ask patient not numbing. Okay. 2 minutes remaining.
Okay. I want to check joints.
First
Okay.
thing you have to do.
Any
Okay.
deformity?
There is no deformity. There is hotness and swelling in the knee and the elbow. Okay.
Okay.
And there is tenderness. Hotness, swelling,
Okay,
and tenderness.
Okay, Mr. Sami, what is your concern, please?
Doctor, I want to know what is going on with me.
Okay, appreciate your concern, Mr. Sami. From what you told me and from examination, I'm think you have a condition called still disease. This is or juvenile rheumatoid. Juvenile? No. This is adult onset still disease. Okay,
What does this mean, doctor? Is it like my sister?
No, it is not like your sister. This is a condition that your defense, it is mistakenly it is attack your or some organs in your joints and in your skin. Okay.
Okay, listen to you, doctor. Okay.
Okay.
So is it treatable?
It is manageable. It is not treatable, but it is controllable. Okay.
Okay.
Okay. You
Doctor,
have any
time.
concern? Huh?
No, thank you, doctor. Time exactly 9:30, and you started 9:15. Okay, doctor. Muhammad, what is your positive finding in this patient? Make
Okay.
you say this is a still disease.
This is 19 years old male complain of this rash and high temperature and this lymph nodes and splenomegaly. This I think it is my first differential is still disease, adult onset.
What
still
other
disease.
differential you put for this patient, and you tried to rule out by your history or by your examination?
The other is it could be systemic lupus erythematosus.
Okay, systemic lupus erythematosus. Against that,
Yeah.
what?
Against that, it is this is his male, and the distribution of this skin rash, it is not in the face or in sun exposure.
You did not ask about all signs of symptoms of systemic lupus. Hair fall,
Yeah.
muscle pain, rash on sun exposed area, rash on the in the face area. Okay.
Yes, yes, yes.
Okay. Also, antinuclear antibody mostly positive in systemic lupus erythematosus. Mostly positive in systemic lupus. Here is given negative. What other
Yes,
differential
negative.
you can add in this patient?
It could be lymphoma. It could be
Okay.
HIV. Huh? Could be HIV,
Okay.
but no history
One
of
by one.
travel or no. Yes.
HIV. There is a
Yes.
history of travel. The patient traveled already to India. What other
Yes.
risk factor or high behavior risk factor you did not ask about to rule out HIV in this patient?
Yes. This is tattooing, piercing, and needle
Yes.
sharing.
You didn't ask about tattooing, sharing, needle sharing, piercing, or even IV drug user. You did not ask about
Yeah.
that.
Yes.
Only
Yes.
you selected only one extramarital relationship. Okay.
Yes. Yes. Yes.
Okay. So another differential.
Another differential. The differential, I have no in my mind. I'm not sure.
You have to put all or most of autoimmune disease. The patient has characteristic of autoimmune disease like rash, joint pain. You have to analyze joint pain if there is stiffness with joint pain and the symmetry, oligo or polyarticular, and so on. You have to ask about
Yes.
this. To at least put rheumatoid arthritis. You are telling it's called. You said juvenile rheumatoid arthritis at the beginning. Is that
Yes.
right?
Rheumatoid arthritis. Yes.
Okay.
Rheumatoid arthritis.
So the patient, you did not ask at least to rule out rheumatoid arthritis by the pattern of the joint
Stiffness.
affected,
Mm.
proximal pharyngeal joint and metacarpopharyngeal joint. It spares the distal interpharyngeal joint, and you did not
Yes.
ask about the stiffness, and if there is
Yes.
stiffness, for how long in the morning. This is very important. Okay.
Yes.
Any other
Yeah.
differential you can put for this patient? There is a lot of differential for this case, really. A lot of differential.
Yes. This is rheumatoid arthritis, and
The main rule in the exam, not to diagnose, is to put a very reasonable differential diagnosis. Yes, because you did not do lab, you have only one lab that antinuclear antibody is negative. This is can help you to some extent, but not totally.
Yes. 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 It is dermatomyositis.
You can still in the lymphoma you said before. You said
Yes.
lymphoma.
Lymphoma. Mm.
lymphoma, and also
Yes.
infection. You said infective endocarditis, you said HIV. You can put
Yeah.
any infection can cause fever.
Tuberculosis.
Any infection like Epstein-Barr virus, cytomegalo, the mononucleosis like this group also
Yeah,
can cause
mononucleosis.
same manifestation. And the
Yes.
tuberculosis, brucellosis. Brucellosis can cause fever, joint pain, maybe skin rash, and there will be splenomegaly or hepatosplenomegaly, and also there will be lymph adenopathy. Okay.
Yes. Yes. Yes.
What is the investigation for this patient, Dr. Muhammad?
This investigation is the basic of CBC, urea electrolytes, ESR, C-reactive protein, and ferritin.
Ferritin, how
This
much
is
will be ferritin?
ferritin is become too much. I'm sick more than 400.
Okay.
More than 2,000. Huh?
It will be very high. Yes, it may be more than
Very high.
1,000.
Yeah. Yeah. Okay. And antinuclear antibody already done, and anti-CCB.
What else? Okay. What else is very important?
Yes, and joint
If I ask
X-rays.
you now, if I ask you, this patient came to you and you said this patient is still disease. Okay. So I want you to select one test to confirm your diagnosis, or two tests.
The first is ferritin.
Ferritin is very high, more than 1,000. What else?
And after that, this is white blood cells. And
No, rheumatoid factor should be negative. Rheumatoid factor should be negative. Okay. Raised inflammatory marker, ESR-CRP, leukocytosis, should be high, more than 14,000. Neutrophilia, mostly about 80% of your white blood cells. Okay. Marked elevation of serum ferritin more than 1,000, and the negative rheumatoid factor, and the negative antinuclear antibody. Negative autoantibody, this is very important in your diagnosis. Okay. And some affection, maybe there is anemia, maybe there is thrombocytosis, maybe there is some affection of the liver. Okay.
Okay.
Do you know the criteria for diagnosis for still disease? There is a criteria.
No, I'm not mind. I'm not sure.
Criteria by Japanese doctor. Yamaguchi criteria. Yamaguchi criteria. Okay. About 7 point or 8 point. At least you have 5 point.
Okay.
2 of them should be from the measure. The measure criteria in your patient, there is fever more than 39. Okay, but should last more than 2 weeks. You have to ask about. I will go back to your approach in the history, but in taking the history of fever, you have to analyze the pattern of the fever, first time or no, because recurrent fever different from first time fever. Okay. Consequence, duration. Okay, and is it recorded, documented by the patient, and it's low grade or high grade? Is it associated with night sweating, rigors? Then you have to screen for a focus of infection quickly.
Okay.
Screening for the focus of infection you can take in the head, for example, runny nose, throat pain, ear discharge, neck pain, and so on. Okay. Chest pain. Take 1 or 2 questions quickly from every system and coming from up down. It will be easy, very easy, as if you are anatomically going there.
Okay.
Okay. This is regarding fever. Then another major criteria is arthralgia or arthritis, at least more than 2 weeks. Fever more than 1 week, arthritis more than 2 weeks. The rash, salmon pink rash, and leukocytosis, as you said, more than 10,000 or 14,000, sometimes 10,000, some books 14,000, but at least neutrophilic count should be more than 80%. Minor criteria in this patient, there is negative antinuclear antibody, and supposed to be there will be negative rheumatoid factor. Other, there is lymphadenopathy and splenomegaly. This is considered the minor criteria. And the sore throat, this is common in the patient with still disease. Okay.
Sore throat.
Yes, and if you did lab abnormal liver function, in your patient you have fever, you have arthritis, you have the rash, okay, you have lymphadenopathy and splenomegaly, and you have negative. If you asked me about if you asked me about sore throat, I will tell you there is sore throat and there is negative anti-nuclear antibody.
Yes.
Then we will go for the treatment.
That
Management
treatment.
process. Yes.
The management, it is I think it is non-pharmacological.
Okay.
Okay, it is to avoid this any vigorous exercise because this is splenomegaly.
Okay, but it's mild splenomegaly, not vigorous
Not
exercise
huge.
in huge splenomegaly or friable splenomegaly. Massive spleen, like what is the cause of massive splenomegaly, by the way? What is the cause of massive splenomegaly? Which causes a huge spleen. Huge
It
spleen
is
means it will cross the midline of the tummy, of the abdomen, or go back to the left iliac fossa. This is the mean of a huge spleen.
okay. Okay. The main cause, I'm think Kaladar and
You should
thalassemia.
not put Calazar first one. You should put
Thalassemia.
no, chronic myeloid leukemia first. Hairy cell leukemia. You can put chronic malaria. Then you can put Gaucher disease. You can put glycogen storage disease and thalassemia. No, it will not cause like this. Okay. This is a massive splenomegaly. But just palpable spleen, most you will find like still disease, brucellosis, typhoid, even in viral hepatitis, in infectious causes, just palpable spleen. You may bulbate or you may not bulbate. But in infectious mononucleosis, it is tender. That's why, and friable. That's why it can easily rupture. This is another issue. Okay.
Yes.
Non-pharma patient education, patient counseling about his condition. Okay.
Yes.
And what is a pharmacological treatment?
Pharmacological is it is non-steroidal anti-inflammatory.
Yes. Okay. Trial of non-steroidal first. If no response,
If no response, go to this is tumor necrosis factor anti.
you may use tumor necrosis factor, but at the end, not the beginning. First, you tried non-steroidal. Okay, agree with you. Then, no response, you will try steroid, like rheumatoid arthritis exactly. If no response, you'll go for disease-modifying anti-rheumatic drugs like methotrexate. If no response, you'll go for biological agent like interleukin-1 inhibitor. And this is the last step if it is refractory to all the previous medication. Okay, Dr. Muhammad.
Okay.
حظك ان الحالات دي not common in Irish. هي جت معاك يعني I know you are Irish. فتخلينا انا كنت هجهز لك حاله والله بس دي كانت جاهزه اساسا اني ما توقعتش انك
ما في
but
مشكلة.
for this patient even because you may find some cases like fever in Irish you may find it will be dermatomyositis, it will be infective endocarditis. So fever approach, rash approach, you have to ask first. Rash not common now in Irish because the question show me the rash will not be there because it's surrogate. So mostly it will not come. If this patient may come with fever for you. So fever, as we said, first time or recurrent, it will be different. First time or recurrent, for example, in your case in Irish, fever, first time or recurrent. Now I put in my mind fever, Mediterranean fever, number one, for example. Okay? Pattern like this. Then the onset course duration. Okay? Any association like rigors, night sweating, screen for any focus. You definitely will find associated symptom to catch in it. Either awareness of heartbeat to go for infective endocarditis, either chest cough or chest pain like this during coughing to go for pneumonia, bronchitis, and these issues. Or you'll find tummy pain to go for any Crohn's disease or anything ulcerative colitis. Anything can cause in the tummy, or joint pain, which is the most common to go for autoimmune disease. Not necessary that he's male, that is not having autoimmune disease. Okay.
Yes. Okay.
Then you have to analyze joint pain because you found now a positive finding. You asked about association. There is positive finding joint pain. You have to ask about the joint pain as the same. First time or current, onset, course, duration, and association. Okay, what increase or decrease, and the stiffness and the secretes. Don't cite character, radiation, and score. This is very important. Okay, to guide you and narrow your differential. This is regarding this. In your examination, you have to examine for the positive finding found in your history, or you are trying to rule out any differential. You are very late to, you did not even examine joint pain, right? Although it's one of the
Yeah. No,
important
I'm examining, but late, yes.
Yeah, you don't know. Patient came with rash and you found there is joint pain. Focus on skin rash and joint pain. Then, according to what came in your mind, according to the scenario, examine the other system. Okay? And differential,
Okay.
don't be hesitant to put a reasonable differential diagnosis, because this is very important. It's not good to give only one or two differential, at least 4 differential and the very strong differential. If you will put a little bit odd differential or don't go with the scenario, you can say against that, for example, against that the patient not having a typical feature of systemic lupus erythematosus. Okay, doctor?
Okay.
Okay, Dr. Muhammad, first, do you want to ask any question related to this case or any question?
No, thank you, Dr. Talat.
Thank you, Dr. Muhammad. Anyone want to ask any question?
Yes, doctor, regarding the differential diagnosis for this case.
No. Hello?
Yes.
Yes, doctor. Some interruption.
Yes. I'm sorry. I asked regarding the differential diagnosis for this patient.
Okay, you can put other autoimmune like systemic lupus rheumatoid arthritis. You can put infections like Epstein-Barr virus, cytomegalovirus, HIV virus, and infections like brucellosis. And also you can put malignancy like lymphoma, because there is fever, there is fever, there is lymphadenopathy, there is splenomegaly. So 4 or 5 is very enough. Any other questions?
Infective endocarditis will not be a differential, right?
Infective endocarditis will be differential if there is anything in the history can lead him. But infective endocarditis, maybe there is fever, maybe there is lymph node, maybe there is splenomegaly due to splenic infarction, maybe there is also weight loss, and also it can affect the joint, can cause osteomyelitis or can affect any joint in any way. But the patient he did not ask completely about the IV drug user or something like that lead us to infective endocarditis. But if you put in the differential, it will not be wrong.
دكتور طلعت هنا Schoenlein Berbera maybe in the differential diagnosis of this case or not?
Initial Berbera will be younger age and there will be abdominal pain. Okay, definitely there will be joint pain, but mostly in the knee, and there will be hematuria. This is very important. There will be hematuria. And the rash, the other rash is purple rash. This is a salmon pink maculopapular rash. It will be like macule and the babule about more than 1 centimeter. Macule, any discoloration in the any discoloration of any rash, this is called the macule.
Can you show the rash, doctor?
Sure, doctor. This picture from up to date. This is the rash. This is the maximum. I can't do more zoom more than this. Is it obvious or no?
Yes, doctor. Doctor,
Okay.
in this case, the ESR and the CRP will be very high, right?
Yes, it will be very high. ESR, CRP, inflammatory marker, all will be high. Leukocytes will be very high, mostly neutrophil at least more than 80%, and ferritin is very high. Okay, this case is very deceiving, because you may suspect that CRP is high, ESR, CRP, ESR high, leukocytosis, and the patient come with throat infection and fever. Definitely, you can say this is tonsillitis. And even if you did ferritin, okay, it may be as a one of acute phase reactant. You got the idea? There is inflammation. Sometimes ferritin it will be high, not still disease, but as a part of acute phase reactant. Any other question? I want to read the comment. I think. Anyone ask any question in the comment?
Doctor, is it common to come in the MRCP like this case?
It can come, yes. MRCP now, anything
Hello,
can come.
doctor.
But yes, with you. Hello?
Yeah, it can come in MRCP, yes?
Yes, it can come, doctor. They brought leptospirosis in previous diet. They brought gastroenteritis last diet also. But in Irish, most will not come.
Okay, thank you, doctor.
Thank you. Any other questions? If no more questions, I will close. Okay. Okay. Thank you. Assalamu alaikum wa rahmatullah.